Now, the size of the capsular axis has to be smaller than the optic diameter. So
Okay.
if you notice, 5.5 millimeter, 5.25 millimeter, and 5 millimeter. It is a good idea to be able to do a 5 millimeter axis in toric. If not, 5.25 is also okay.
Right.
The moment you go beyond 5.5, the capsule starts becoming big. The lens will have chance of rotation.
Rotation.
So if you are a surgeon who's comfortable and expert at making small axes and putting the lens, I would recommend a 5.25 or a 5 millimeter. If the anterior capsule coverage is irregular, like in the right side of the partial coverage,
Right.
you will see that these lenses will rotate over time.
Okay.
Sometimes you have lost the marking during your surgery.
Right.
You see, this patient is taken up for surgery. We had marked him outside the theater, but he had long waiting. After 35 minutes, he comes into the OT, there is no mark. What do? See the trick for beginners. You just use a little bit amount of a dye called trypan blue, and you'll suddenly see the mark starts appearing again.
Right.
There you see,
Ah,
the mark has come back.
right.
And now you can remark it with your pen on table. So
Hmm.
again, tricks for beginners. These are small things which observation will give you. So now you mark the original mark again. Always dry the surface before you mark, otherwise the ink will spread. Now
Okay.
your marks are back again.
Hmm.
Now you're back in the game.
Hmm.
Small tricks. These are markers which you can use to make the size of the axis you want. You can use a 5 millimeter, 5.5 or a 5.25. You can just make a mark and you can make the, so this beginners can use this to standardize their axis size. So see, I'm using a central marker.
Right.
I have created a mark on the cornea. And now if you notice, I have actually decentered the circle because the Purkinje reflex is in the center of the circle, though the circle may not look in the center of the eye. What I have to place the lens on is, this is the center,
Right.
not the diameter center of this. So see, I have made a axis which follows this circle,
Right.
and I have a 5.25 millimeter axis which is bang center. There you are. So beginners can do that. Now you see, now if you
Right.
see, the axis looks eccentric. It is shifted towards the left.
Right.
But is it shifted? No. Look at the Purkinje reflex. My Purkinje reflex is absolutely in the center. Again, an experienced and a person who's used his judgment over time knows this. Normally, any beginner surgeon would want to make the axis in the center. Here I've purposely shifted it because my Purkinje reflex is shifted. This will give excellent results. This separates a good surgeon from an excellent surgeon, where you are planning, you are observing. So observation gives you analysis. Analysis gives you good outcomes and excellence. Another thing which I would say is, suppose the bag size is very big,
Right.
high myopia, use a CTR or a CTS ring which stabilizes the bag. It stretches the capsule so that the capsule touches the posterior part of the lens and it sticks. In a big bag, the bag is loose. The bag is away from the posterior part of the lens. It's not touching. The lens will rotate. But when you use these rings, they stretch the bag. The capsule comes forward, touches, stops rotation. So my cutoff is, if axial length is more than 26 millimeters, I will use a CTR. So there differentiates one surgeon's results from another. Both big bags, one surgeon does the surgery, after 1 week the lens rotates, in another surgeon it doesn't rotate. The second surgeon used a CTR, so it didn't rotate. But he had to be aware, he had to have analyzed his results, that why do my lenses rotate in big bags? And then how can I stop the rotation? If I put a ring, will it stop? Try in 2 cases. Stops. Good. Observation, judgment. Next case, you're putting a ring. So this is what separates.